New guidelines say it's safer for women considered at a low risk from complications to give birth with the help of midwives rather than in hospital with doctors.
The National Institute for Health and Care Excellence is recommending midwife-led units or home births for 45% of all pregnant women in England and Wales. Our health correspondent Bronwyn Jeffries reports.
A birthing unit in Hexham General Hospital run by midwives. Today's new guidelines say women who are expected to have straightforward labours are safest being cared for by midwives rather than doctors, and that's something welcomed by staff here.
It gives women a greater choice, and a lot of women want to have that homely environment to give birth in. We all know the benefits of delivering in a midwifery-led unit, the one-to-one midwifery care that you can get when you're in that type of environment. That has a massive impact on women's experience.
Midwife-led care has significant benefits for pregnant women who are considered low risk and who've given birth before, according to the health advisory body NICE. For them, home births are 5 times less likely to result in a caesarean than those on a traditional hospital ward, 4 times less likely to have forceps used, and almost half as likely to lead to a blood transfusion. Those behind the new advice say they're not sure why hospital care results in more medical procedures.
It might be that women are frightened, it might be that it's not homely, it might be that the care is more fragmented or doctors are going too far. But what we do know is that for women who are low risk and straightforward, being in a midwifery-led setting gives better outcomes for the mother.
But for first-time mums, the guidance warns there is an increased risk to the baby's health if they're born at home. The new advice for women has been broadly welcomed by doctors who specialise in delivering babies. But the Royal College of Midwives is warning, with a shortage of more than 3,000 midwives in England, the government must continue to increase the numbers to ensure a real choice of care for women. Sophie Hutchinson, BBC News.
And we'll get